Okay, our slideshow is on leukemia in children. Leukemia is a group of blood cancers that usually begin in the bone marrow. The result is a high number of abnormal white blood cells are created and released into the bloodstream. The blood cells are not matured or fully developed and are called blast or leukemia cells. The cause of leukemia is currently unknown. For leukemia, there are different types of leukemia. There's acute leukemia, childhood leukemia, plasma cell leukemia, chronic leukemia, mast cell leukemia, and mixed phenotype acute leukemia. The most common type of leukemia in adults is chronic lymphocytic leukemia. The most common type of leukemia in children are acute lymphocyte leukemia and acute myeloid leukemia.
Signs and symptoms to look out for: bruising tendency, leg and joint pain, feeling overtired, abdominal pain, enlargement of lymph nodes. Symptoms may develop gradually or may be sudden onset. Things to look out for in terms of integumentary system: unusual lemon yellow coloring of the skin, petechiae, purpura. Other signs and symptoms include thrombocytopenia, deficiency of platelets in the blood, anemia, lack of red blood cells in the body, hematuria. Blood in the urine may range from microscopic is not visible at all. The patient may experience weight loss, vomiting, anorexia, and dyspnea. The kidney may become enlarged.
Okay, treatments. The most common treatment for childhood leukemia, along with any other cancer, is chemotherapy. Depending on the severity of the cancer, high-dose chemotherapy may be given. As mentioned, children are given chemotherapy. However, a popular way that the chemo is given to a child with leukemia is intrathecal chemotherapy, which is chemotherapy given into the cerebrospinal fluid. The purpose of doing it this way is to kill any leukemia cells that might have spread to the brain and spinal cord. It is started by giving twice the first month, and it goes to giving several times during the next 1 to 2 months. Methotrexate is the medication of choice for intrathecal chemo. Hydrocortisone and cytarabine may be added for higher risk children. Radiation and stem cell transplant. Radiation therapy is also an option given to prevent or treat the spread of leukemia to the brain. It is also given to treat the testicles in boys if the leukemia has reached them. Radiation is also given before a child is given a stem cell transplant. The most common stem cell that is given is allogenic stem cell transplant. In this type of transplant, the blood-forming stem cells are donated from another person. The donor's tissue type should match the patient's tissue type as closely as possible to help prevent the risk of major problems with the transplant. It is usually taken from a sibling with the same tissue type as the patient. Sometimes the umbilical cord stem cells are used if it was stored by the parents. Immunotherapy and natural remedies. Other treatments are immunotherapy, which is taking the T cells out of the child and taking it to a lab to genetically alter and multiply and give it back to the child so that it can attack the leukemia cells. Some patients also use complementary and alternative methods, such as adhering to a special diet, taking vitamins, herbs, going to get acupuncture or massage. It is stated that these methods might be helpful in relieving symptoms or helping people feel better, but have not been proven to work. Some might even be harmful. Care for a sick child. Caring for a child at home is almost as similar to caring for an older adult. Move comfortable clothes to the front of drawers or the closet. Having hats or scarves to keep head warm in case of hair loss. Have blankets available for them if they're cold. Use of non-slip bath mats in and out of the tub. Keeping hallways and staircase lit. Removing slip rugs to not have children slip. Wash hands often, avoid visitors who are sick, avoiding crowds of people, wearing a mask in crowds and doctor's offices, and cleaning the child's toys regularly.
Patient teaching for a child with leukemia. Seek immediate medical attention for the child if they are febrile or have any signs of bleeding. Children may participate in activities but should be cautious with strenuous activities such as exercising or lifting. Prevent infection. Wash your hands often and avoid being around people that are sick. Prevent bleeding and bruising. Use a soft toothbrush and do not floss your teeth when your platelet count is low. And drink liquids as directed. Drink extra liquids to help prevent dehydration. A neutropenic diet is recommended in children with leukemia. This involves choosing foods that will lower the risk of foodborne illness. The diet should be served as follows. No fresh fruits or vegetables may be eaten along with garnish. All foods must be cooked. Meats should be fully cooked and until well done. Many experts recommend that school-aged children should attend school as much as possible to help maintain a daily routine. Children should also be encouraged to keep relationships with friends because friends can be a great source of support for the child.
Stages of leukemia. Leukemia is a cancer of the body's blood-forming tissues, including bone marrow and the lymphatic system. Many types of leukemia exist. Some forms of leukemia are more common in children. Other forms of leukemia occur mostly in adults. Leukemia usually involves the white blood cells. Stage 0 is low risk, high lymphocyte in the blood. Stage 1 is intermediate risk, high lymphocyte count in the blood, swollen lymph nodes. Stage 2 is intermediate risk, high lymphocyte in the blood, swollen spleen or liver, with or without swollen lymph nodes. Stage 3 is high risk, high lymphocyte count in the blood, low red blood count, anemia, with or without swollen lymph nodes, spleen, or liver. Stage 4 is high risk, high lymphocyte count in the blood, low platelet count, with or without low red blood cell count, anemia, swollen lymph nodes, and swollen spleen or liver.
Here are some statistics in childhood leukemia. Even as the cure rate continues to improve, the incidence of childhood cancer has been steadily increasing over the last few decades, from about 15 children per 100,000 to over 21 children per 100,000. Acute lymphoblastic leukemia, or ALL, is the most common children's cancer. It accounts for 25% of all cancers in children under the age of 15. There's 3,000 new cases diagnosed in the U.S. each year. This picture is of a postmortem pediatric patient whose diagnosis wasn't discovered until their autopsy. The leading cause of death by disease among children in the U.S. is cancer with 51%. There's 7 children diagnosed daily. The average age of diagnosis is 8. Over 40,000 children undergo treatment each year. Leukemia accounts for 24% of the 17,293 diagnosed per year. In the last 40 years, the survival rate for children's cancer has increased from 10% to over 85%. Here's our reference page. Thank you, guys.